You are listening to the People First podcast.
People First is a self-advocacy group run by people with learning disabilities, and People First podcast is a platform to raise awareness about real issues that affect people with learning disabilities in our community and all around the world.
We aim to inform and entertain our listeners by interviewing interesting guests and talking about the things that really matter to us. This is like having a stage to speak out and get our voices heard.
The People First Keighley Craven office is in Keighley's Central Hall. Central Hall hosts all sorts of events, and this week we attended a drop-in session where you could get a COVID vaccine booster, a flu jab, and even annual health check. Members of our broadcast team attended the event to speak to some of the healthcare professionals who were working at the event. We recorded this broadcast at a busy event. Please excuse the background noise. First of all, we spoke to the organisers of the event. Hello, could you please introduce yourself to our listeners?
Yes, Bill Graham from the Modality GP Partnership.
What does GP Partnership do?
Well, we're general practitioners, so we look after people's health in the community. People will be used to going to their GP surgery for any health issues or for their prescriptions or whatever they need to stay healthy.
What's happening at today's event?
Well, today we're running an event for people with mixed abilities and learning disabilities where they can come along, get their vaccinations up to date, whether it's their COVID vaccinations or their flu vaccinations, and we can also offer them a health check. It's really important for people to have a health check every year if they have sort of learning disabilities or mixed abilities, because it's a chance for them to just get checked out and have that sort of health check-up that's really important, because not everyone's always aware of what's happening with their body. So it's a nice chance for folk to get that done in a really nice environment and have a cup of tea and meet lots of their friends as well. So it's a nice friendly setting for people to come and have those health checks and vaccinations done.
Are Modality running more drop-ins at any point?
Yes, we've got 6 of these events happening throughout November. So we've got Highfields next Tuesday, Airedale Shopping Centre on Wednesday and Bracken Bank on Thursday. And then on the 23rd of November we're at the KAWAC, the Keighley Asian Women's and Children's Centre, doing a similar event as well. And hopefully we'll be doing more of this next year.
Why is it so important for people to get COVID booster?
I think in the current circumstances where there's still an awful lot of COVID in the community, it's really important for folk, particularly people who are vulnerable with vulnerable health conditions, to make sure they've protected themselves and protected their family, and they're not going to have a serious illness if they catch COVID. So all the evidence shows that having your COVID jabs and your COVID boosters will protect you and protect the people around you, your family and your loved ones.
Many thanks for talking to us. We also spoke to some of the healthcare professionals who were delivering the healthcare.
I'm Vicky Donnelly and I work at Waddy Loves, and I work with some of the GP practices to improve access for people with learning disabilities.
Why is it important for people to have a COVID booster jab?
So people with learning disabilities in particular are quite high risk of getting COVID and getting really poorly afterwards if they do get it. So we're really wanting to encourage as many people as possible to have their COVID booster so that they don't get too poorly if they do get COVID.
What should you do if you feel unwell after a COVID booster?
if you feel unwell after your COVID booster. So you need to take some paracetamol probably, and just keep an eye on how you're feeling. You need to drink plenty of fluids still, even if you're feeling a little bit off it. And usually, if you're feeling unwell, it will go away after about 24 hours. And I think if it lasts longer than that, then you maybe need to talk to somebody about it.
Are the vaccines working as well as hoped?
I think what we can see from people going into hospital is if you end up with COVID and you've had your vaccines, you'll be less poorly than if you haven't had your vaccine. So I think they are working to stop people getting as poorly as they would have done before.
What are the best ways to protect yourself from COVID-19?
Well, to be honest, Tom, I think we probably still need to stick to lots of the rules that we had in before. Personally, I always feel like it's useful to continue to wear a mask. It's helpful to keep washing our hands regularly, and it's helpful to keep socially distanced from people. I don't think any of those things are a bad thing to continue doing to keep yourself as safe as possible.
Can you have a COVID vaccine and a flu jab at the same time?
Well, the evidence from today is that yes, you can, can't you? Because we've been busy giving people both the flu jabs and their COVID boosters, different arms, but on the same day. So yes, you can definitely do that.
Why does COVID seem to affect people with learning disabilities more than the rest of the population?
Okay, yeah, that is a good question. So I think that often people with learning disabilities will have other health conditions, so they may be more at risk of asthma and other respiratory diseases. We know from things like the LEADER report, the respiratory disease is the biggest cause of death for people with learning disabilities, and COVID is linked to your respiratory system, so that is probably why people with learning disabilities are more at risk, as well as having other underlying health conditions like things like diabetes and heart disease and all those other things that increase your risk from COVID.
Who is eligible for an annual health check?
Okay, so anybody who is on the GP's learning disability register and aged 14 or over is eligible for an annual health check.
Why is it important to have an annual health check?
So an annual health check is a good opportunity for people to just have a yearly review of all of their health issues, where they can talk to the GP or the practice nurse or the health support worker, depending on who's doing it, about how they're feeling and what's going on for them with regards to their health. Sometimes people can't always tell people if they're in pain or something doesn't feel right, so the annual health checks gives the person the opportunity to have those checks done just in case there's something going on that they don't know about. And it's a good opportunity to talk about routine screening like cervical screening or breast screening or bowel screening if you are entitled to those things, just to make sure that people have all the health checks that they should. And overall it should reduce health inequalities for people with learning disabilities.
What can people expect from an annual health check?
So, in your annual health check, there are all sorts of things that they should talk to you about. They should do things like weigh you and check your height, check your blood pressure and your pulse. We've been asking people more recently to check people's oxygen saturation levels, so they put a little monitor on your finger and check what your oxygen levels are so that we've got a baseline for that. They should talk to you about going to the toilet and whether you get constipated. They should talk to you about your breathing and your chest and whether you've had any chest infections. They should talk to you about your mental health and how you're feeling emotionally. They should talk to you about cancer screenings, like we've just said. They should talk to you about having your flu jabs and your COVID vaccines now. What else do they talk to you about? They might want to do some bloods so that they can check what your bloods are like. And if you're on medications, they might want to talk to you about your medications as well. So there's lots of different things that should be discussed with you in an annual health check.
Brill, thanks for your time.
You're welcome.
Thank you, Vicky. Next up, we spoke to the GP GP stands for General Practitioner, a type of doctor who deals with all types of ailments and illness. Hello, could you please introduce yourself, for our listeners?
Hello, my name is Dr. Parsons. I'm a GP at the Kilmeny Surgery in Keighley. Been working there now for 21 years.
Why is it important for people to have a COVID booster jab?
Okay, so we've had a really successful rollout of the COVID vaccination. The pressures on the NHS this winter are substantial because we've still got a lot of COVID knocking around, and we've got a lot of just general virus knocking around as well. And so the COVID booster is to try and protect yourselves and to protect others by making sure that the NHS doesn't get overwhelmed. So I would recommend it to all if you get the chance to get boosted.
What should you do if you feel unwell after a COVID booster?
That's a very good question, Tom. I mean, again, people should perhaps understand that that you can have some side effects from the COVID vaccine. So, again, you can have local effects in terms of your arm. So your arm may feel a bit sore, it may feel a bit achy, you may get a bit of a rash, a bit of bruising. You may also experience sort of side effects for up to a couple of days, really. So these may be feeling a bit fluey, so you may have a bit of a temperature, you may feel a bit achy, a bit more tired. These are entirely normal and to be expected. It's if you continue to feel unwell, perhaps at day 5, day 6, day 7 after the vaccine, and then you should be getting in touch with your own GP or 111 just to go through your symptoms with them, because again, at that stage it's probably unlikely to be the COVID booster. In terms of how you manage the side effects, if your arm is painful, then just some simple pain relief like paracetamol. Again, if you've got a bit of a temperature, simple paracetamol to bring your temperature down, and the usual sort of self-remedies that you would take if you had a cold. So rest, fluids, and accepting that your body will get better after a few days.
How often are people going to have to get a COVID booster?
This is a good question. We don't yet know is the actual answer. But you could see how, because again this is going to be predominantly a winter virus, so it's going to be worse during the winter months, so you could see perhaps how an annual booster similar to the annual flu campaign may be introduced. But at this point in time that's not policy, but you could see how maybe going forward we may end up with a joint flu COVID vaccination, I suspect.
Are the vaccines working as well as hoped?
I think the vaccines are working probably better than hoped, if honest. They are incredibly effective. What we have to try and remember, if we can, is that the vaccines are not necessarily to stop you from getting the infection, but they're to stop you from being incredibly poorly, or worse still, dying. So they are designed to keep people out of hospital and to become incredibly poorly. If you look at the current figures, then you can see that whilst we've got as much COVID as we've ever had in this country at this point in time, the number of people in hospital, the number of people unfortunately dying is a lot less than it was at the start of the vaccination program. So I think we can see that the vaccination program has been incredibly successful at stopping people becoming very unwell, or worse still, unfortunately dying.
What do you think about the new antiviral drugs from Pfizer that we have all read about?
It has to be... It's exciting. We don't, as yet, have access to them, but the fact that we've got them as an available step for use in the community, again, all of these things has to be a good thing, and it's exciting. I think there will be limits as to how we are able to dish them out. I suspect they will go to the clinically vulnerable or the most at-risk population, but again, it's just, if you like, it's another string in our bow at tackling this virus, which has now been with us for, close on 2 years. So anything which helps that fight is a good thing.
Why does COVID seem to affect people with learning disabilities more than the rest of the population?
Excellent question. Again, I think learning disabilities is again generally a little like people with older people who have chronic conditions. They're just more vulnerable to this virus, unfortunately. And it was one of the learnings from the early days of the pandemic, and why it's very important that we get people with learning disabilities and those who are clinically vulnerable vaccinated and then boosted with the vaccine to try and prevent the complications from this virus.
Apart from having a vaccine, what are the best ways to protect yourself from COVID-19?
It's going back to the simple measures that we had before the vaccine existed. So again, it's good hygiene, so hand washing, space, so keeping socially distanced, which reduces the rates of transmission, and then wearing your mask when that seems sensible. So in a crowded area or with other vulnerable people, then it would seem sensible to continue to wear a mask, particularly with the high levels of COVID that we have at the moment. But again, it's that, if you like, hands, face and mask. Or hands, face and space, I think it was, wasn't it?
Can you have a COVID vaccine and a flu jab at the same time?
The simple answer is yes, and we would encourage and have given lots of vaccines, COVID vaccines and flu at the same time to lots of people so far. I guess you can, if you're nervous, have them 7 days apart, but if we get it all done in one day, it saves you the bother of having to come again, and it's one less thing to do. So absolutely safe to have them both together.
Brill, thanks for your time.
My absolute pleasure, and thank you for inviting me here today. It's a really, really special event. I hope it's the first of many. I think this is the way forward in terms of reaching out to a really important part of our community.
Mortality 1 in more, a drop in infants in Keighley all November. Many thanks for listening. Please like and share.